A lot of people have simply accepted that blurry vision is just what getting older feels like, something that happens, something you adjust to, something you learn to live with. You wake up and your eyes are dry, irritated, slow to focus. You find yourself squinting at the restaurant menu from across the table, and driving at night, headlights hit you like a flashbang, and without realizing it, your hands grip the steering wheel just a little tighter than they used to. But here's what most doctors never slow down long enough to tell you. That's not always just aging. Not always. The American Optometric Association is clear. Once you cross 60, your eyes become significantly more vulnerable. Dry eyes, cataracts, macular degeneration, sudden blurry vision in just one eye. These become far more common. And the National Eye Institute has warned that vision loss among Americans is accelerating faster than any point in recorded history. What makes this especially alarming is where the real damage happens. Not during the day, at night. While you're sleeping, while you believe your body is resting and recovering, your retina, the light-sensitive tissue lining the back of your eye, isn't always getting the oxygen and nutrients it desperately needs. The delicate photoreceptor cells, responsible for clear vision, begin to quietly break down, and most people don't realize it until the damage is already significant. This is the question I hear almost every week in my practice. Why is my vision getting worse? And is there anything I can actually do about it? Naturally, without another prescription or another conversation about surgery. Here's the uncomfortable truth. Most common solutions, eye drops, stronger lenses, even laser procedures, they treat what you can see. They don't address what's causing it. And that is precisely why the vision care industry generates billions of dollars every single year, while older adults keep losing ground. A study published in JAMA Ophthalmology in 2023 confirmed what researchers had been observing for years. Age-related retinal damage begins with silent changes deep inside the eye. Oxidative stress, chronic low-grade inflammation, and critically, these changes are most aggressive at night, exactly when your eyes should be in their deepest repair cycle. But here is the part I genuinely want you to hear. More recent research has found something that changes this conversation entirely. Certain everyday fruits contain natural compounds that your eyes are essentially starving for during sleep. Compounds that can support the regeneration of damaged photoreceptor cells, improve circulation to the retina, and help slow the progression of macular degeneration, the leading cause of central vision loss in adults over 60. You may be able to support clearer vision naturally, safely, while you sleep. No prescription refill, no surgical consultation. And the number one fruit on this list, the one that surprises almost everyone, is probably already sitting in your kitchen. It contains a natural enzyme shown in research to directly interfere with one of the most destructive and least talked about processes behind cloudy lenses and early cataracts. I'm Dr. Deborah William. I work with older adults every day who refuse to treat vision loss as something inevitable. Today, I'm walking you through 7 fruits that research suggests can support overnight eye repair and exactly how to use each one correctly. Stay with me through this entire list, because if you leave before number 1, you'll miss the fruit that ties everything together. Let's count down from 7. Number 7, kiwi. Here's something that happens to most people and nobody explains why. You wake up, you blink, you reach for your glasses, you put them on, and things are still fuzzy. Not dramatically, just enough to be unsettling. And 45 minutes later, your vision finally starts to feel normal. Most people chalk that up to age. I used to let it go too. I don't anymore. While you sleep, your retina is actively trying to repair itself. But when it's not receiving the right nutrients during that window, the damage accumulates, night after night, quietly, without warning signs. Kiwi is loaded with lutein and zeaxanthin. Think of them as internal filters sitting inside your retinal layers, absorbing harmful blue light and providing antioxidant protection during that overnight repair cycle. Kiwi also contains a small amount of serotonin, which supports deeper, more restorative sleep. and deep sleep is when your eyes do their most critical recovery work. These two benefits are more connected than most people realize. A study in the Journal of Nutrition and Healthy Aging found that older adults who ate 2 golden kiwis daily experienced measurable improvements in visual sharpness and reduced morning dryness. How to use it. 2 golden kiwis, not green, about an hour before bed. Golden varieties carry more lutein and are gentler on your stomach late at night. And don't scoop all the way to the edge. That thin layer of flesh just beneath the skin is concentrated with caffeic acid, a powerful antioxidant. Scoop gently and leave that inner layer intact. Watermelon is over 90% water, which helps with hydration, but the deeper story is lycopene, one of the most potent carotenoid antioxidants in food. Studies link it to reduced oxidative damage in retinal cells and protective effects against cataracts and macular degeneration. Compounds in watermelon also support nitric oxide production, which relaxes and widens blood vessels, including the microscopic capillaries that feed your retina overnight. How to use it? 1 to 2 cups, chilled, about 30 minutes before bed. No added salt. Sodium raises intraocular pressure, which the Glaucoma Research Foundation identifies as a serious and potentially irreversible risk. And don't discard the white rind. That section most people throw away contains citrulline, an amino acid that supports healthy blood vessel function. Blend it into a smoothie. What looks like waste is quietly doing real work for your eyes. Number 5, black currants. Most Americans have never bought these, and I think that's part of why so many people's night vision keeps silently declining. The specific problem black currants target is chronic low-grade inflammation in your retina, combined with reduced blood flow to the optic nerve. That combination is what creates halos around headlights. That's what causes worsening eye strain in dim rooms. A stronger prescription cannot fix this. It doesn't reach the source. Black currants contain remarkable levels of anthocyanins, the deep pigments responsible for their near-black color. Inside the eye, they calm inflammation, support blood vessel dilation, and help restore rhodopsin, the visual pigment that controls how quickly your eyes shift from bright light to darkness. That shift slowing down is why night driving feels so much harder than it once did. A randomized placebo-controlled trial with glaucoma patients found that 50 milligrams of blackcurrant anthocyanins daily over 24 months significantly improved optic nerve blood flow and meaningfully slowed visual field loss compared to placebo. How to use it? Fresh blackcurrants are hard to find. Look for a standardized extract of around 50 milligrams taken in the evening. Pair it with a few walnuts or a slice of orange. Fat and vitamin C both enhance absorption here, and that pairing genuinely changes the outcome. Number 4, blueberries. You probably eat these already, and there's a good chance you're unintentionally canceling out most of their benefit. Blueberries target oxidative damage in your photoreceptors, the cells responsible for focus, fine detail, and adapting between light and dark environments. The key compound is pterostellbene, which research suggests can cross the blood-retinal barrier and act directly on DNA damage in light-sensitive cells. Most antioxidants never get there. This one does. A 2023 study in Nutritional Neuroscience found that older adults consuming wild blueberries daily for 12 weeks showed notable improvements in visual acuity and significantly less eye strain in low light. How to use them correctly. About 1/3 of a cup of wild blueberries, the small dark ones from the frozen section, not the large cultivated supermarket variety. Wild blueberries carry nearly double the active compounds. And here's the mistake I see constantly. Don't eat them with dairy. Milk proteins physically bind to anthocyanins in the gut and block absorption. Instead, lightly freeze your blueberries, then let them thaw before eating. That breaks down cell walls and dramatically increases how much your body can actually use. Number 3, dragon fruit. I know this one sounds unusual. Stay with me. If you wake up with heavy, tired eyes, even after a full night of sleep, pay close attention here. The problem dragon fruit addresses is retinal hypoxia, when your retinal tissue isn't receiving adequate oxygen during sleep. 8 hours of rest still leaves you exhausted behind the eyes. Peripheral vision softens, colors look duller, and the cumulative damage over time is significant. Red-fleshed dragon fruit, the variety matters, white flesh won't do this, is rich in betalains, antioxidants that support nitric oxide production in blood vessel walls. Nitric oxide widens capillaries, including the tiny ones supplying your retina. More oxygen, more nutrients, during the hours your eyes need it most. A 2022 study in Frontiers in Aging Biology found participants consuming red dragon fruit extract for 6 weeks showed meaningful improvements in ocular circulation, contrast sensitivity, and visual field depth. How to use it? Half a red fleshed dragon fruit about an hour before bed and chew the black seeds. Don't swallow them whole. Those seeds contain omega-3 fatty acids and magnesium, both documented for retinal nerve repair. Swallowed whole, you lose almost all of that benefit. Number 2, goji berries. 2,000 years of traditional use, and the clinical research is now catching up in a meaningful way. Goji berries target macular thinning specifically. The macula is the central zone of your retina responsible for the sharp vision you use to read, recognize faces, and see color clearly. Gradual oxidative damage to this tissue is the foundational process behind age-related macular degeneration, one of the leading causes of irreversible vision loss in adults over 60. Goji berries are among the highest natural dietary sources of zeaxanthin on the planet. Zeaxanthin concentrates specifically in the macula, providing targeted protection exactly where central vision loss begins. A 2021 study in Nutrients followed adults aged 60 to 80 who ate dried goji berries 5 days a week for 90 days. Results showed a significant increase in macular pigment optical density, a direct measure of macular protection, and not one participant showed further progression of macular degeneration during the trial. How to use them? Soak 2 tablespoons of dried goji berries in warm water for 10 minutes, then eat them about 30 minutes before bed, and pair them with a small square of dark chocolate, at least 85% cacao. Cocoa flavonoids have been shown to enhance zeaxanthin absorption. Together, they create a synergy your macula can genuinely use, and it's not a bad way to end your evening. Number 1, papaya. Here we are, and I meant it when I said this one would surprise you. Papaya isn't exotic, it isn't expensive. You've probably walked past it dozens of times without a second thought. But eaten correctly, at the right time, prepared the right way, it targets the single most underappreciated cause of vision decline in people over 60. It's called glycation. In plain language, when excess blood glucose binds to proteins in your eye tissue, it forms compounds that progressively cloud your lens and degrade your retina silently, continuously. You don't feel it happening, but over time it drives cloudy lenses, early cataracts, and that stubborn morning blur that no eye drop seems to fully resolve. And not anybody is talking about it. Papaya contains papain, a naturally occurring enzyme with documented anti-inflammatory and protein-modifying properties, alongside vitamins A, C, and E, and folate, nutrients consistently linked in research to tear film stability, retinal protection, and reduced oxidative stress inside the eye. A 2023 study in clinical gerontology found that older adults who consumed papaya in the evening showed lower glycation markers at follow-up, alongside stronger tear production and measurable improvements in contrast vision within 6 weeks. How to use it? 1 cup of ripe papaya cubes about an hour before bed. Fresh only, not processed, not juiced. room temperature, not cold from the fridge. Cold suppresses papain activity, so take it out 30 to 60 minutes before eating. No dairy alongside it, and squeeze fresh lime over it before eating. The vitamin C significantly boosts vitamin A absorption. Your eyes get more of what they need, and genuinely, it tastes better too. 5 rules before you go, because without these, you won't get the full benefit. Avoid high calcium foods within 90 minutes of your fruit. Dairy can reduce absorption of key eye nutrients by up to 30%. Always add a small healthy fat alongside your fruit. Walnuts, flaxseed oil, avocado. Absorption of fat-soluble nutrients can increase by more than 50%. Wash your fruit gently under cool water. Aggressive scrubbing strips surface antioxidants. Let fruit reach room temperature before eating, and eat in that 60 to 90-minute window before sleep. Too early, and the nutrients metabolize before your repair window opens. Too late, and digestion disrupts the deep sleep your eyes need. Blurry vision is not simply the price of getting older. It is often the result of specific, addressable processes, and growing evidence suggests these fruits, eaten the right way, can genuinely support what your eyes are already trying to do every night while you sleep. Think about waking up and seeing clearly within minutes, reading without squinting, driving at night without that tight grip on the wheel, looking at the people you love and catching every detail. That's what this is really about. If your vision became noticeably clearer tomorrow morning, what's the first thing you'd want to see? Leave it in the comments. I read every single one. Hit like, subscribe, and share this with someone over 60 who needs to hear it. You might make a real difference for them. This is Dr. Deborah William. Your eyes are irreplaceable. Take care of them, and I'll see you in the next one. And if this reached you, help Dr. Deborah reach 1,000 subscribers, because this is exactly what 1,000 people need to hear. This video is for educational purposes only and does not constitute medical advice. Always consult a licensed eye care professional before making changes to your diet or health routine. Individual results may vary.